All right. Drug use is one of the most costly aspects of society today, costing the U.S. $600 billion, not million, annually, and factoring into 1 in every 4 deaths. The Office of National Drug Control Policy bases their policies on the idea that addiction is a disease. I'm going to show you why disease is a misnomer for addiction, how this misnomer has heated our efforts at lowering the impact of drug addiction, and what a better name or category might be for addiction. First, why addiction is considered a disease today. When anything affects our brain, it stimulates a certain amount of dopamine transmission in the nucleus accumbens shell located there. This means that if we like something, dopamine is emitted in our brain, and we associate that positive feeling of dopamine with a certain stimulant, be it video games or meth. When we play video games, that stimulant undergoes one trial habituation, which means that dopamine is incrementally decreased over successive use of that stimulant. This is why we lose interest in certain repeated activities. When we smoke meth, however, one trial habituation does not occur. This means that the same amount of dopamine is released with each successive use. This strengthens drug-stimulant associations in the brain and increases an addict's motivation to get that drug. More of an addict's brain is devoted to getting the drug than they previously would have before they had become addicted. So now, organizations like Alcoholics Anonymous label addiction as a disease, and it removes a good bit, almost all of the choice from the addict. An addict labeled this way would feel sick, trapped, and alone because the only cure would be a change in their behavior. And with the disease and the same environment that caused it, this would feel very trapping and hard to overcome. This is why instead addiction should be labeled as a learning disorder, one that develops through a negative environment and a negative outlook over time. Whereas someone labeled with a disease would feel trapped, someone labeled with a learning disorder would feel that they still have some choice in their actions and their addiction. And through a developed will and confidence, they can help themselves to overcome their addiction. Organizations like Alcoholics Anonymous teach the theory to their patients that addiction has become a part of them, and that they will never be able to separate. But this only gives an addict an excuse to relapse, because they've been taught throughout their treatment that addiction has become a part of them. So they just think, and then they use because it's a part of them. Instead, we should be teaching an addict that through independence and will, addiction can be permanently removed. Whereas a mental disorder can be overcome through gradual steps, a disease requires a specific medical intervention to fix. We need to teach patients this thinking so that they can better help themselves. Our drug policy should also reflect this thinking. Rather than arrest and financially punish a drug user, we need to show and support them through a positive environment of self-assurance, which would greatly contrast with the cold, demeaning jail cells and overwhelming courtrooms that convicted addicts spend a majority of their time in today. Through the same reason that reinforcement is shown to be statistically more effective than punishment, a positive reinforcing environment will promote self-help better than a negative one does. We need to reinforcement over punishment. We need to re-educate a frustrated addict's brain, and teach him that his brain is actually a muscle that, if properly used, can help him overcome the impairment and disability that addiction causes. We need to inspire and empower all drug addicts, so that they can get themselves out of the addiction relapse cycle that society has caught them in, and they can thrive as people again.
Created using Powtoon.